Hello everyone, Hong Kong #1 podcast team. Today away on the road and visiting one of the clinic here in Hong Kong. And as usual, I yield the floor to Mr. Banker to introduce our really excited guest.
Today I have the privilege to introduce Dr Andrew Wong, who is an honorary infectious disease consultant at Princess Margaret and other private hospitals in Hong Kong. He was a consultant in charge of infection control and infectious disease at management of public hospitals.
Sorry. Just that Princess Margaret is a public hospital.
Yes.
But at the same time, I work at several private hospitals as well.
Yes.
You may know.
Thank you very much for the clarification. His passion includes infectious diseases and everything to do with infectious diseases. And today we're going to talk about the human papillomavirus, or HPV. So welcome, Dr. Wong.
Thank
you very much for being with us today.
We are so much looking forward for this conversation.
Yes.
Let me start first. Obviously, over the past 2 years, the profession as a virologist become on the very high demand. And I personally had experience in the midst of 90s to start my academic career with a medical college as a paramedic laboratory assistant. And I will share later maybe my impression about that. So it's like almost 20 years ago. So what brought you to this profession? And of course you cannot become now a virologist over the night. So it's take my very long destiny. So could you please share with us
your background? How did you
First of all, I chose medicine because I've always been fascinated by science and to help people, and the reason why I chose infectious disease as my specialty is a lot of coincidence actually. When I was a medical student, when I went out to Australia for some elective, was in the final year, and I was allocated a unit where infectious disease patients, especially HIV/AIDS patients, were seen. And I was there for 1 month, 1 whole month in Sydney. And I was really impressed, and I decided that, I really want to help this group of people, because at that time, in the early 90s, there was still no medicine for HIV, or just started to have the first one, AZT. Right. And I chose internal medicine, and eventually choose infectious disease as my specialty, because I think for other system like specialty which specify look after only one system, for example cardiology, they are looking only at the heart and the vessels. For gastroenterology is only on the gut.
Yes.
But our specialty actually span the whole body, and actually sometimes it's not only infectious disease as such, and then there may be other quite interesting and rare diseases as well, presenting like infectious disease.
Right.
In a sense, our work is just like a detective, because people, for example, who come up with a fever of unknown origin, and then we have to, step by step look for the cause. Actually, it's quite fulfilling, when we can diagnose some condition and then we treat them, accordingly.
Yes.
And the more I do it, and I've been in this specialty for almost 20 years now. More than 20 years.
Fantastic.
Yeah.
And then you keep on, you never lost any interest, any tiny amount of interest.
Yes. And then there are so many new things to learn, and then for example for the HPV, and then I actually focus on that in the past few years. So that's why I'm doing the things that I'm doing. So they are ever changing, especially in this new era. We expect, these sort of emerging infectious disease will come up, just like COVID, and then before that is Middle East respiratory
Yes.
syndrome and avian flu. It's non-stop.
Right.
And Ebola and also at the background we have the problem of antibiotic resistance. So this is specialty which span clinical and public health. That's why I like
Alright.
it so much.
Combination, this hybrid with
Yes.
Yes.
But is the antibiotic resistance due to the new strains of virus being more resistant themselves, or is it just because people aren't there's an instance of people not taking the full antibiotic course, and therefore the resistance of the virus is increasing? Is that what is the cause of that?
Actually, in general, for resistance to take place, usually there is like a pressure from the antibiotics or antivirals. After the bacteria or virus is exposed to a certain chemical, they are very clever. I always say, all the microorganisms, they will find way to evade these drugs. So the more drugs they are exposed to, the more the chance is that they will become resistant.
Right.
Of course, there are sometimes that they will appear, this sort of resistance appear de novo, meaning that they haven't been exposed to drugs by some sort of mutation.
Yes.
It's a possibility as well.
Right.
Same for COVID now.
Right.
That this RNA vaccine, RNA viruses, actually they are very prone to mutation.
Yes.
Yes, every
Alright.
time they copy itself, there will be some errors. But
Yes.
many of these errors may not be significant. When
Yes.
these errors become significant, and then they will become a significant mutation.
Yes.
Okay.
So it's a trial and error on the part of the virus. What makes them the most resistant and the longest lasting. What is the status of HPV at the moment in terms of the viral resistance, and how is that at the moment? Is it evolving, or is it quite
Actually,
treatable?
human papillomavirus is the most common viral STD, sexually transmitted disease, in the world, all through the
I've been
different.
looking at the figures. So it's 79 million people in
Yes.
the States are affected.
And
Yes.
it's
It's incredible.
14,000 daily affected. 14,000.
It's very common. It's the most common, actually, it's the most common sexually transmitted disease and the most common viral sexually transmitted disease. And it's estimated that people from virgin to people who haven't been exposed to sex before, half year after they start any sort of sexual activity, more than half of them will acquire one HPV type or more.
Right.
And the other thing is it doesn't have to be penetrative sex.
Right.
Even skin to skin contact will transmit this virus.
Goodness.
Yes. That's why many people ask me whether put on a condom will always protect against HPV. The simple answer is sadly no. No, because you cover only part of it.
Yes, exactly.
So the other part, I've seen so many different types of manifestation on the skin. So can be
Goodness.
other places that is not covered by the condom.
Yes. But what is the percentage of asymptomatic carriers of HPV versus those that display HPV symptoms?
To answer this question, I think we have to understand more about different types of HPV. Actually, there are more than 100 types of HPV types, okay? And around 40 types are genital, affecting the sex organs, okay? And out of which, around a dozen of them are so-called high-risk HPV types. Right. What is meant by high risk? High risk meaning they might cause changes on the cells, okay, and causing some of these pre-cancer changes. And if they proceed, they may proceed to cancer, okay, but it's in terms of years, not immediate. Usually, this sort of high-risk virus, they are invisible at the beginning,
Right.
because the pre-cancer change you cannot see, on naked eye, except when they become sizable at a particular size, become bigger size, and otherwise it is invisible to the naked eye. Whereas for some other genital wart types, they can cause the classical genital wart, just like the cauliflower things, on the genitals.
Yeah.
And these types are usually the low risk types.
Right.
So the lesions that you can see are usually not the high risk type, but the high risk type are usually invisible, and they may cause change and then cause cancer eventually.
Yes.
And the thing is, they not only affect the genital, now we know. And for example, for female, now we know, apart from cervix, which all the people know is related, can also cause cancer of the vagina, cause cancer of the outer genitalia, the vulva.
Oh, goodness.
And for women, anus as well. Actually, for women, cancer of anus is more common than for men.
Oh, goodness.
And for men, it can cause cancer of the penis and the anus. And in both sexes, they can cause cancer of the oropharynx, that is the oral cavity, and the pharynx.
Right.
And actually, it's becoming more and more common in the West, with the sex
That's surprising me after I did some research. That's surprising me that it doesn't really, the data is not plummeting where is the countries. It's literally everywhere the same. And rely on that. We have many questions from our listeners, and we certainly will draw some parallel today with the COVID as well.
Sure.
Yes.
So why do you think, as a specialist, some viruses become a mainstream? Like what you're talking about now, could be really significant threat to the health. Many people, especially like youngest people who will start their sexual life. And it's not in the mainstream. I remember 90s, maybe beginning on 20s, there was quite a lot of advertising, a lot of information around about the HIV, HPV, but now it's not. It's so silent. Therefore, we're so excited. So why you think one virus, why one virus come to our radar and another just gone, which is not, doesn't mean you fix the problem, right?
No, not
it's
at
not
all.
eradicated.
Not at all.
So why you think it's happening?
On the contrary, I think it's becoming more common because on daily basis, there's also many people come down with very unfortunate stories, of being affected, and then some of these lesions can affect not only their health but also their psychological well-being and also relationship.
Who decide which is most dreadful virus right now? Who decide? It's not the numbers, as I can see. Like with the virus we're talking now,
that's right.
The numbers is significant high.
Yes.
So and it's still not in the mainstream, and many people might listen now and say, "Oh, why talk about this? This virus I never heard about this. Why we need to talk about that?"
So much so that I think now with HIV, actually there's very potent antiviral available, and then you can take, and then you can suppress it for life. On the other hand, for this HPV, there's no single treatment.
Right.
Which is very effective.
Question. And how many years humanity tackled this virus?
Yeah, what was the development of it? Was it something like the plague, which started off as quite a low-level, difficult infectious disease and then increased?
Actually, it has always been there. Just that with the now people may be having more liberal sex, and then there are more
advanced
transmission. Transmission. And I agree. The awareness is a lot high. Especially in even among the teenagers, and then I think it's very important to emphasize that in sex education, so that they can know how to prevent from acquiring it. Of course, we will talk about vaccination later on, which is very super effective, and then everyone who is eligible, I think should have it.
Yes.
So because one of the questions from our listeners is why also, all the questions why, why some viruses can be prevented by vaccination and some are not. But we did the research on HPV. We actually we have a vaccine,
Very
right?
Yes.
effective vaccine. Very
Alright.
effective.
90% effective.
Yes.
So
Yes.
do all the viruses, the humanity invent the vaccination for all the viruses now they existing or not?
No, not
Okay.
yet.
Can you
I
tell
wish
us,
that-
please? We want now see here. We'll not let you go today if you don't tell us what is our future, please. With the vaccination, and so HPV has a vaccination. So
Yes.
let's say if I do this vaccine, I can enjoy whatever sex I want.
No.
Okay.
Because even for example, for example, take for example of anal cancer, 90% of the anal cancer is caused by HPV, and the remaining 10% is due to other factors. Okay,
Oh, wow.
and that means even
Yeah.
if your HPV vaccination is 100% effective, you are going to have 10%, that 10% chance of developing even if you are vaccinated. But of course, with a very good surveillance program, the high risk patient can be monitored, and then we will try to reduce mortality and morbidity associated with the cancerous change.
Please.
Yes.
And but the thing is, this vaccine is very effective, and it there's no need for booster. So once you take it, just like for people less than the age of 15, you need 2 doses, and above the age of 15, you need 3 doses.
Right.
Yeah, and then it can theoretically last for your life.
Oh, right.
So you said there is no 100% protection from this, from HPV.
It's not 100%, but near to 90, over 90%.
Alright. And by vaccine.
By vaccine.
And also hygienic precautions.
Mm.
Or
Safer
not really.
sex, of
Safe
course.
sex,
Safer
right.
sex.
But is it the matter of the HPV causing the cancer? Is it because that your resistance level generally drops, and therefore you're more prone to cancer, or is it just a development and it becomes the HPV symptoms, or the warts become malignant and form the cancer? Is that how it develops?
Edward, you asked a very important question. And actually, yes, most of the people who acquire these HPV viruses, they will get rid of them within like half a year or 1 year, 90% of the people. But there are some cases where this virus will persistent. What are the risk factors for persistent viral infection? It is it has to do with the immune system of the patient. For example, if the patient is immunosuppressed due to some sort of disease like HIV/AIDS, or they are on immunosuppressant, for example, I've seen many patients who have transplant before, or they are on corticosteroid or other immunosuppressant for other, like for example, autoimmune disease, SLE, rheumatoid arthritis, and also people who have these high risk types virus, especially type 16 and type 18, which accounts for over 70% of the cervical cancer or anal cancer. And also people with multiple sexual partners, and people who are smokers. They have,
really?
Yes, smoking has synergistic effect with HPV in causing cancers. And so all the patients, I will advise them to quit smoking.
Big regard to all the smokers.
Yes.
Yes. And
why so? Why so? Because it's the immune system weakness, or it's somehow related to the viral.
You mean smoking?
Yeah.
Actually,
so
smoking is by itself is carcinogenic for many diseases, and then it was found that together with the HPV, it's not only 1 + 1 = 2, it's 1 + 1 = 3. They accelerate the changes, of progressing from persistent infection to low-grade precancer change, to high-grade precancer change, and finally to cancer. But
Right.
note that usually there's a lag phase. It's not immediate, after infection that this sort of changes will occur. Usually what you are talking about, like 5 years, 10 years, 15 years, 20 years later. It
Right.
depends on the degree of infection,
Yes.
how badly you are infected by these viruses.
Yes.
And the viral load at the local site, how much virus is there, factors like that, and how immunosuppressed you are,
Right.
Yes.
that will also affect.
Did I get you right that all the viruses which come to our life, they will be there forever? We just learn how to control them, so you cannot irradiate, you cannot completely vanish them.
It depends on what kind of virus you are talking about. There are some viruses of which once you're exposed and then you develop immunity for life.
Yes.
For example, hepatitis A, once you
Right.
get it, you would have immunity for life.
Yes.
But there are some viruses which can lie latent in the body. For example, the chickenpox virus and the varicella virus, and then they will once after infection, they will hide in the neural terminals, in the nerves.
Right.
And then when you are stressed or when your immune system is weak, this virus will comes up again onto the skin and cause herpes zoster.
Yes.
That it depends on different type of virus. But for HPV, they can cause persistent infection, and then they can be there without symptoms, and
Yes.
without checking, people will not know they are affected. There are a lot of people who are affected without knowing so.
Yes.
Yeah.
But you talk about the final, eradication of HPV in the future. The last successful time that was done, I believe, was with smallpox.
Yes.
In 1980.
Yes.
Well, how was this? Would it be possible to carry out the same system for eradicating HPV that was done for smallpox, or is it a different ball game for that?
For that, I think some of the criteria which are needed for eradication of a viral disease would definitely include an effective vaccine, and two, there should be a system to administer this vaccine to everybody.
Yes.
And thirdly, there should be a system to detect those who are infected and then
Yes.
to help them. And I think certain criteria have been met. For example, there's such a vaccine. This vaccine, the nanovalent vaccine, which cover 9 types of HPV.
Oh, sorry, is it the valent 19?
Nano.
Sorry,
Nanovalent meaning
Nano.
covering 9 types.
Oh,
Alright.
right.
Yeah, 9 types. Yeah.
That's
Right.
very big success.
Yeah.
9 types compared to the last generation is 4 types and then 2
Wow.
types.
Oh, wow.
This the new one cover 9 types, and but still they are very effective, and also on the field experience show that they are very effective. For example, in Australia, after they administer the vaccine first to girls and then subsequently also to the boys, and they found that the incidence of viral wart much dramatically decreased in this adolescent group. And then also among the girls, the cervical precancer change and subsequently cancer change also much reduced. Okay, and it's very successful. And then there are a lot of other success stories around the world. And so vaccine-wise, yes. But, whether everybody will uptake the vaccine is another matter. And that will depend on a lot of factors. Whether
Yes.
the country is rolling out a national program to give it for free.
We
As-
can learn from today how it actually goes with vaccination, right? So it's not the easy
Not
task.
an easy thing,
Yeah.
to get now that
Convince.
yeah.
But what's the situation like in Hong Kong? Because I remember as a kid growing up here, we had things for polio, we had BCG shots. So
Yes.
is it provided as part of the package for kids?
Beginning from starting from 2019, Hong Kong, as a part of the childhood immunization scheme, they will give girls studying in primary 5 free
wow.
HPV vaccine, you know.
Right.
And then for first dose, and then in primary 6 they will have the second dose. Starting 2019, that is 2 years ago.
Yes.
But
it's not compulsory, right?
it's not
just-
compulsory.
okay.
They have
Elective.
to sign the agreement form
Yes.
with the parents, of
Yes.
course. You know,
They're minors, yes.
And what
Um,
is it? Sorry, what is the statistic? Like how many dropouts? Like no, or they?
What's the percentage of uptake for the
Yeah.
vaccination so far?
I don't have the figure here because somehow this program was just rolled out at beginning of the
90.
COVID. Yes,
Right, right.
the
Okay.
bulk should be
That's-
in during the COVID time. So somehow because it's the a school vaccination team who will go up to the school to give the vaccine. So somehow some of these schedules are affected by the school disruption.
Sure.
So but I'm sure after the COVID thing is gone, and then that will resume. But the fact that program is only for students, female student at the age of at primary 5,
Right.
and there's no plan for other for catch-up vaccination for other
and
forms.
not for the boys.
No.
Right.
not
That's
not yet
interesting.
for Hong Kong. Not yet for Hong Kong.
Right. Is
Yeah.
it because girls are more susceptible to...
Yes, you may say so, because traditionally we are associating HPV with CA cervix,
Yes.
cervical cancer. So
Right.
most people will
Yeah.
think of that. But actually now we know the vaccination of boys are equally important. Why?
Yes.
I tell you why. One of the reasons is that if the vaccination rate among the girls is not as optimal, if we also vaccinate the boys at the same time, actually, by theory of the herd immunity, we will also protect the community
Yes.
more, and so the boys actually they have to be vaccinated to protect the girls at the same time. Okay.
Yes.
And the other thing is actually the infection in boys is quite common. I saw many in the clinic, with genital wart. Even genital wart can be quite devastating.
Yeah.
Yeah.
Also,
Yeah.
I'm surprised about the gender difference in this. Yeah.
Yes.
Why it's even
Yes.
there.
Yes, even for genital wart can be, quite severe. Even though for immunocompetent, normal immune function boys, they can have.
So it's to reduce the incidence of the rate of HPV in boys anyway. It's not, it's preventative, of course, as well, but it's to reduce the incidence of those which have already got symptoms of HPV.
Usually early HPV they don't have any symptoms, you know.
Yes.
But the other factors why boys have to be vaccinated is that we now know across all culture, 10% of the boys will eventually they will be men who have sex with men. So if we just vaccinate the girls, this group of men who are practicing sex with men will not benefit at all,
Right.
So, but during the teenager, most of them they may not know for sure, or they may not volunteer that they will
Right.
have sex with men in their adulthood. So, if we vaccinate them respectively,
Yes.
then we will protect this group of patients. And now we know HIV and HPV, people who are HIV positive, together if they have HPV, they are more prone to all kind of cancer changes.
Sure.
So I think it's good to protect them early.
That's amazing information. I actually surprised about the variables in that matter.
Yes.
Like we talk about the gender and we talk about the sexual orientation, and it's of course it's everything must be there important.
Mm-hmm.
But it's all about, as well, I think, giving the vaccination, but that doesn't give them license to think, oh, I've had the HPV vaccination now, I can do whatever I want.
That's
No,
what I
no.
asked before.
No.
Yeah. So
There are other
Yeah.
STDs as well, which you have to prevent.
yeah. Also, we have some questions, and I want to go back to 1990s, right? When I remember that medical college and with our fragile minds, to say it's the least, we had access to all this like dangerous substance to study things, and yeah, there's a crazy memory about that time. And you probably finished also by that time in the 90s, right? I saw in London the diploma. So how can you evaluate right now the changes in the approach, how to teach people about this, how to, like, does AI helps a lot now to fight with viruses or acknowledge people, like all the modern communications, like how do you think it's changed? Or it's still in the same, like petri dish, test tube, that's it, the maximum what you can have for the study about viruses? And
I mean, for diagnostic, of course, we have many advances, now, especially now with the COVID, and then we are talking about all sort of molecular diagnosis for more rapid diagnosis. Okay, so we are using like PCR
so
based
diagnosis is improved, right?
That much improved compared to 20 years ago. Okay, and there are more rapid tests available, and sometimes even these sort of tests are like point of care, so that you can have the result right away when you see the patient. And so diagnostic is one thing, and vaccination availability is one thing. So far, for all the STDs, mainly HPV is available, the vaccine, and the other one is hepatitis B, which is sometimes transmitted sexually. Okay, so but it seems that the awareness still, there's a lot of room for improvement.
Right. Yeah.
People, for example, for HPV, many of them have not heard about that they can cause so many cancers.
Sure. Yeah.
Yes. And what has caused the lack of awareness? Is the awareness for the general public improving for HPV now, or do you think that there should be more, like, campaigns by the government or funding from the government? I don't know how that works, but how is that?
I think there, in the recent like 2 to 3 years, there are more publicities on HPV, which I'm happy to see. But still, when you are talking about people's understanding of how vaccine will protect them, and how important is it for them to get vaccinated, there's still a lot of room for improvement. And also, I think the other thing is that the government can consider is to cover at as a second step. I think it's good that they start at the P5, but there are other girls as well, who are not covered. I think the next step for the government is to cover the girls of other age groups, and then eventually the third stage will be to cover all the boys, okay, so that the newer generation, they will be protected, like we are talking about invest in the future.
Fantastic, yeah.
And for example, 10 years or 20 years later, this group of teenager, when they grow up, they would not come down with that sort of cancer.
Yes.
That will protect their life, and then keep their health. Of course, we are talking about sexual health. Is not only HPV. There are many other sexual transmitted disease.
Yes.
And so general sex education is also important, so that people will know. Now we are not talking about safe sex. We are talking about safer sex only.
Yes,
exactly.
No, they'll never be completely safe.
Yes.
Sex.
Yes. If you want to be absolutely safe, the
don't have sex.
Yes, abstinence is the only way.
Yes.
Of course, we are not advocating that.
Yeah, what about the stigmatization about it? Because I remember when I grew up, HIV, it was something like
Yes,
really
you were a
scary thing.
pariah.
It's only related to somebody who used drugs, who like low social level people, so
Mm.
which is absolutely wrong. Like
Mm.
everybody.
Yes.
So do you think it's improved during the 20 years,
Like,
10 years?
yes, cultural attitudes and things.
I think it's improving. Yes, improving. But still, it's sad
Good.
to see there are certain, sometimes some people who are treated unequally. That's
Yes.
why I always advocate on many occasions to treat all these patients, irrespective of the cause, why they get it.
Mm-hmm.
It's
Yes.
immaterial, I think, for me.
Yes.
It's only a viral infection, okay? To treat them equally, okay? Because many of these people they have double stigmatization.
Right.
For example, for example, in Hong Kong, the culture is that people who for example, gay,
Yes.
they are stigmatized, and then if they come down with HIV infection, they are doubly
Yeah.
Of course.
stigmatized.
Yes.
And then many of them choose not to tell
They,
anybody.
Yeah, they
Yes.
might perceive this as a punishment or something. I deserve it, or right. This
Yes.
is really difficult to deal with this.
Yes.
And we have our journey now into the psychological path. And what do you think? It's already scientifically proven that if you're psychologically healthy, let's say, so your physical health also improve.
Yes.
And it doesn't relate to the viruses, you think, or it's also can be, I mean, your way of thinking, your way of approach life, I think it's also can be a big helper.
Of course, in general, I think I myself, I tend to adopt a very holistic way of looking at health. It's
Mhm.
not only physical health, but also mental and also even
Wonderful.
spiritual health.
Yes.
But for this virus,
You cannot
for that
pray. You
infection.
cannot pray for
yeah,
this.
maybe it may help a little bit, but I think it need to be dealt
Right.
with like medically.
So it's
you
more
know.
technical approach to deal with
Yes,
this.
better to
Mm.
prevent it rather than to
Yes.
get it first in the first place by
Mhm.
vaccination, and then for the present generation, like the people in their 20s and to the all the sexually transmitted, sexually active age groups,
Mhm.
actually most of them they haven't been vaccinated. The present, for example, Hong
No.
Kong population. So they,
Mhm.
for example, the women, they still need to have the a regular cervical screening,
Sure.
Mm.
and then
Yes.
and for the other groups who are high risk for anal cancer, and that's why I'm advocating the use of anal cancer screening for
Right.
these high risk group. For example, the people who are immunocompromised, like HIV and transplant or on immunosuppressants, or women who had vaginal or vulval or cervical cancer or precancer change before.
Right.
They are also more prone to, for example, anal cancer.
Sure.
So some sort of screening will help them to detect
Yes.
these lesions
Also,
early
the screening is the number one, right?
Yeah.
The precaution.
for
Right.
people
Mhm.
who are
Alright,
already infected.
Okay.
Yes.
But how does Hong Kong rate internationally with the HPV treatment and recognition of the disease and things? What is Hong Kong standard? Is Hong Kong at the forefront of HPV sort of development?
Actually, I have been to a few of these developed countries for my training and professional development, and to UK, US, and Australia, and to Netherlands, and some European countries. Actually, many of these countries, actually, they are quite advanced already. They have some sort of screening program in place, especially for anal cancer. But for cervical cancer, Hong Kong is quite. The program is quite robust already. for the
Right.
ladies, and then most of them, the ladies will know they will have a regular screening. But for anal screening, Hong Kong is still in its infancy, whereas in many developed
Wow.
countries they have already
Oh,
developed.
right.
Yeah,
All right.
and for vaccination, Hong Kong is just start.
Mhm.
2
Right.
years ago as a puppet. Of
Yes.
course, people can, by all means, pay out of pocket to get it in the private clinic. But in many other developed countries, or even developed countries, they have already started for more than 5 years or even 10 years
Yeah.
So
for vaccination.
do I understand right? It's more it's the higher problem is more advanced technologies in those countries like vaccination. Maybe Hong Kong doesn't have that big problem with this. Therefore, you said it's just 2 years ago. It's impressive they started the vaccination.
Maybe due to a variety of reasons, but the
Mhm.
vaccination per se is not something
Yeah.
like high sounding, technologically demanding.
Mm.
Just that I think is the awareness of the
Yeah.
people, and
Again,
also
come back to
Yes.
awareness.
policy. Usually
Awareness
whether
and
to make it
policy.
as part of the childhood vaccination program.
Yes.
Yes.
Well, with things as they stand at the moment, you're talking about the eventual elimination of HPV.
Mhm.
What timescale do you put on that, if at all possible, if everything was lined up the way you would like it to be? What kind of time frame are we looking for the elimination of HPV?
Actually, these sort of viral disease elimination, and for example, for hepatitis B and C, actually, WHO is also setting a target like by the 2030, 2030, there should be marked reduction in the number of cases, and they target at eradication. But for HPV, I think it will be in terms of like 10 to 15 years at least.
Mm.
At least.
Yes.
It will really hinge on a number of factors.
Really impressive. Yeah.
First
Yes.
of all, I think all the countries, they have to vaccinate the people who hasn't been exposed.
Yes.
As a priority, both
Mm.
men and women, both girls and boys.
Yes,
Okay.
definitely.
So the thing is, this vaccine is quite expensive.
Yes, I'm
Yes,
sure.
it's
Oh,
quite
wow.
expensive.
Another subject.
So for developing country, it might be a big burden to them.
Mm.
Yes.
Even for the government.
So the vaccine at the moment is not generic. It's made by specific companies. It's not been made generic. I mean, it's not
It's
been.
not yet
No.
generic. So that might be one hindrance.
Mhm.
Yes.
The other thing is the acceptance of people. There are some countries where at the beginning of the rollout of the program, they were hit by some sort of rumors, and then people who are vaccinated will get, for example, some severe side effects.
Oh goodness. Yes.
And then people just spread the bad news, and then they think the vaccine is bad for their health, it's
Right.
harmful to them, and then they stop the vaccination. The
Mhm.
very little
Yes.
people get vaccinated,
Yes.
and that is a pity. For
Yes.
example, in Japan,
Really.
yes, and then they at the start of the vaccination program, there were some rumors, and then it's eventually very the vaccination rate is very low, just like
Goodness.
single digit,
Yes.
and then it was there were some papers, scientific paper, doing some mathematical modeling, and then this generation of people, they will come down with cervical cancer and all sort of HPV
Goodness.
cancers,
Goodness me.
Mm.
and that is really a bit pity.
Yes.
Yes,
Yes,
that
it is.
something like that
Yeah, for
happen.
you as a specialist, of course, when you work so hard
Yes.
to be on the front row and it's just rejected by against stigmatization, law awareness, or
Yes.
just ignorance,
Yes,
And-
and the rumor mill is incredible with what people come up
Yes.
come up with, and social media
Yes.
is no help
Yes.
to that as well.
Our,
yes.
our listeners won't forgive us if we won't ask the question about the current situation. Like, what is your understanding about the future development of this COVID?
COVID.
And, yeah,
Yeah.
how we dealing with this now?
Of course, I don't have the crystal ball, but
Mhm.
from what I observe, more than 1.5 years, and this virus is really very clever, and is a RNA virus, so is has a propensity for mutation. So it seems that the more it mutate, it seems the more it becomes more transmissible, and then also luckily it seems that it's not getting more virulent.
Dreadful, yeah.
Yes,
Not more harmful,
but
but
it's
more
more-
transmissive. Okay.
it's more transmissible, and then many people get infected. But mind you, even that factor will affect the healthcare system because many people will become ill. Even a
Right.
proportion like 1% of the people are severely ill.
Mhm.
If more and more people get infected, that will also overwhelm the healthcare structure.
Mhm.
And also for the vaccine development, I think to a certain extent, the current vaccine, yes, they can still protect against the variant. Although there might be less protection, but still they can protect against the
Mhm.
severe case, and also protect against death. So I still think it's worthwhile to get vaccinated. But in future, I think there is a trend for COVID to become like influenza, and then it
Mm.
might be maybe with us, for the coming. I don't know how many
Future,
years.
yes.
Yes.
All right, just live with this, right?
Live
Yes.
with it, yes.
And then maybe now people are talking about combined vaccine with influenza already. Maybe in
right,
the
yeah.
future we can
Well, we'll see.
have every winter in the northern
Oh, right,
hemisphere.
Yes.
We will get the combined vaccine.
Yes.
That's one way to go. So
Well, try to keep up with the latest variant and the latest strain. Yes.
So
Try
there
to
is
keep
no
on top of it.
data about the strength of the immune system towards this, right?
no.
It's such a short period now.
No.
No.
I think take the analogy of flu. If
Mhm.
more and more people get infected one way or another, so in the whole community there will be some sort of baseline immunity,
Mhm.
and then after that juncture, people may have symptoms like flu, because they have some baseline immunity,
Mhm.
and so it will become like a respiratory, more mild respiratory illness. Of course, even for flu, there are some severe cases,
Yes.
but usually it's in the immunocompromised or elderly people. But
Yes.
I think the future will maybe like that, for COVID will be
Mhm.
Right.
there with us, but becoming more and more like flu, and then we have to get annual vaccination
Right.
to get the
Yes.
protection, and then
Right.
and then WHO will predict which strain will
Right.
be we put on in the current year's
Yes.
vaccine, depending on the mutations, things like that, and I think that's it.
Yeah.
So still I think
That's a lot. Thank you so
Yeah,
very
thank
much
you.
for this solid
Yes.
like projection. It's literally
Yes.
like you have a crystal ball. Yeah. I wish
Yes.
because overall like it's more positive,
Mhm.
Yes.
right? Than
Mhm.
and again, yeah, I can get rid of the thought about the awareness. Like we talk about different viruses, right?
Mhm.
And one is more. It's not the things like one is more important than another or more dreadful. It's just
Mhm.
awareness, and the approaches.
Yes.
Question, no?
Do you have any final words or any final things you would like to say?
For HPV, I think all the probably, I think it's important to realize that it can be quite a deadly virus, you know, and for people who are in appropriate age groups and who are susceptible, they should by all means get vaccinated, which is the most effective means of prevention, and it's proven and it's safe. It has a long track record. So
fantastic.
Yeah, I think the main message is to get vaccinated and continue to practice safer sex.
Thank you very much indeed, Andrew.
Thank you so
Thank you
much.
very
You're
much.
welcome.